Africa is expected to roll out COVID-19 vaccinations from March, and the Independent Community Farmers Association of South Africa says it is ready. Well, let's find out how ready they are to assist in this process. Joining us now is the Chief Executive Officer of the association, Jackie Maimin. Jackie, good morning and thank you very much for your time. I guess it's good news to know that an organization like yourselves, who've got members who are pharmacists in various communities and pharmacy nurses, are ready and willing and able to assist in the campaign, because we've all been waiting for more details from government. While we understand the high-level picture, we are still scant. It's still scant on details. How ready are you as the association?
Hi, Dan, and thank you very much for having me. Yes, I think, as the government has already said, this is a mammoth task. We have never tried to undertake anything of this size before. But I think some of the framework they've put in place will enable us to execute this. So the first thing is that they're doing it in phases, as you know. So phase one are the healthcare workers, phase two, your essential workers and those people that are vulnerable. And then phase three is the bulk of the rest of the population to try and get to that 67%, that herd immunity level. Now, the other thing they've said is that they are calling on all resources. So the state sector and the private sector. And this is where we come in. So, currently there are 3,500 community pharmacies across South Africa. Our members, 40% of them are in under-resourced areas. So we really represent the pharmacies in the rural areas, in the townships, the pharmacy on the corner. On top of that, we've got 12,000 GP practices and we've got 4,500 private nurses. So that brings in 20,000 extra vaccination sites. And we are all galvanizing ourselves and getting ready. And in fact, the rallying call for us is let's unite to vaccinate. Every single one of us wants to end this pandemic and save lives. And so, as I say, we are busy mobilizing ourselves. We've been vaccinating for flu and baby vaccinations for years. This is going to be a challenge, but we're ready for the challenge.
Will you have your members, will they have to learn to do this one differently from a flu jab, from baby jabs? Is there a particular things that are different with COVID-19 jabs?
No. So this is exactly what we do. The COVID jab is almost exactly the same as the flu jab. The one difference is that this first one that they're rolling out, the AstraZeneca one, requires a booster after 28 days. So it needs to be stored between 2 to 8 degrees, which is what we do currently with the flu vaccines and many of the baby immunization vaccines. Our logistics, our distributions are all set up for cold chain. We are experts in cold chain management. And as I say, the only difference is that it requires a booster after 28 days. And this is the current vaccine. We believe that the vaccines that come later, maybe the Johnson & Johnson one, will be a single dose. And then that is identical to the annual flu vaccine.
Okay. Now, you say that you have nearly 3,500 community pharmacies. 40% of them, you say they are in under-resourced areas, in the poorer rural areas of South Africa. Now, we understand that there are conditions under which COVID-19 vaccines will have to be distributed and stored. Will your 40% pharmacies in under-resourced areas have the capability to store the COVID-19 vaccines under the correct conditions?
Okay, so the 40% are 40% of our members. It's not 40% of the 3,500. So 40% of our 1,200 members are in these areas. And yes, absolutely. So part of our statutory council, the Pharmacy Council, South African Pharmacy Council, they go and inspect every single pharmacy to ensure that we have a proper professional private consulting area. They go in and make sure that we've got fridges that are monitored. Our fridges are all checked every single day, twice a day, to make sure that they are within temperature. And then our logistics system, so our distribution and our wholesalers, they currently deliver to those pharmacies, if not on a daily basis, certainly on a regular basis. And the wholesalers and distribution are experts in cold chain. So vaccines will arrive to us in already in boxes with refrigeration tags. Everything is monitored. So you can rest assured that vaccines that are arriving at our pharmacy, the cold chain has been maintained. And then you can also be assured that storage in the pharmacy is being maintained between 2 and 8 degrees. We would then, these vaccines are coming in a multi-dose vial. This is slightly different to the current flu vaccine. The multi-dose vials have got 10 in a vial. We do not know yet, once we've opened it, how soon we need to use it, but we will be ensuring that we rationalize the usage so that there is a minimal wastage. But as I say, Dan, this is what we do, and whether that pharmacy is in a township or in a deep rural area, we all have the same training, we all have the same minimum standards that we have to adhere to.
Now, you as the Independent Community Farmers Association, how are you going to ensure in playing your role that there is accessibility and equitable distribution of the vaccine in those areas?
So glad you've asked that. So the whole South African framework, which we're working within, are on 3 pillars. The first pillar is the science. So the science is our scientists, our Ministerial Advisory Committee. They're looking at the evidence and they're bringing in a vaccine which will be approved by SAHPRA, that it's quality controlled, it does what it says it does, and it's the real McCoy. So that's the first thing, is the first pillar, the science. The second pillar is the ethics. And this is where your question comes in. The ethics is that this country will ensure that nobody is excluded because of race, your creed, your ability to pay for a vaccine. Everybody will be entitled, who is ineligible to be vaccinated, will be getting that vaccine. Now, the exact finance and economics of it, those numbers are like phone numbers to me. I leave that to the economists. But what I do know, for instance, is the medical schemes have already said that they will bring funds forward to vaccinate the 7 million people on medical aid, and that will subsidize a further 7 million. So that's 30% of our population. And my understanding then is that the government will bring up the rest. So state patients will be receiving their vaccine free of charge at these vaccination sites. The mechanics of how the pharmacies will be paid is still under discussion. Medical scheme members, it's a PMB condition, which means it will be covered in full by the schemes. So Dan, I think one of the things our organization really stands for is equity, transparency, and equality. So we will ensure that everybody who needs that vaccine will get it.
Yeah, now finally, this is going to be a longish question. I'm hoping you can bear with me. You said you're going to have an added 20,000 sites in answering one of the questions earlier. And then I've seen your statement where you say if one of them just gives 30 vaccines a day, you'll be able to deliver 12 million vaccinations in 4 weeks, which is a brilliant number to know that your network of independent community farmers association can assist in this mammoth operation in the country. But the biggest question is there are so many doubters nowadays, so many fears around the vaccine and all kinds of conspiracy theories doing the rounds about this vaccine. What are you as an association doing to assist in the correct messaging? So while you are creating accessibility and you are approaching it with an equitable attitude, people actually do come voluntarily, because this is not compulsory, do come voluntarily in the next few months to get the jab. What's your role in messaging and convincing me and others, persuading us that it is safe to get the jab?
So, yes, I think, part of what we need to do is the public health education. And, I think every pharmacy out there, we are healthcare professionals. You can get hold of us. We are really easily accessible. You can just pick up the phone and speak to us, or you can walk into the pharmacy, and we have the information. And it's so important, Dan, because as you say, there are so many conspiracy theorists out there. I mean, I even heard that the cell phones are causing the COVID. There is misinformation, and then there are people also propagating really fake news. So I think you need to speak to people who understand the science, and we will be available to help educate the public. Vaccines have been around for decades, And vaccines save lives. We just need to look at polio. We need to look at smallpox. There's no doubt that vaccines work. And as I already said to you, the SA framework, one of the pillars is that they have got the evidence on this particular vaccine. So speak to us. We'll give you the correct information. And I absolutely believe that every person that is vaccinated is potentially a life saved. We also need to think that on average, every person who contracts COVID passes it on to 2 or 3 people. So every person who's vaccinated, that transmission is stopped. And this is how the herd immunity works. So if I got COVID and I gave it to 2 people, that's 2 more people that potentially could lose their lives, and they pass it on to 2 people. So the minute I'm vaccinated and become immune, I've saved potentially my life, and I've saved all those people that I could have infected, that they could have infected, and it's exponential. So Dan, I think the media has also got a very big role to play here to allay those fears. It is going to be voluntary, and let's hope that 67% of the population will go forward and be vaccinated so that we can bring this pandemic to an end. You know, I think in the first wave, we were looking at statistics. The second wave, we're starting to have family, friends, acquaintances, colleagues who have lost their lives. And it's real and it's dangerous, and we need to stop it.
Thank you very much, Jackie Maimin, the boss, the CEO of the Independent Community Pharmacists Association. Very sensible advice there.